First thing you're going to have to consider as a doctor here, as a chiropractor, you're a primary provider. Now, don't let that word confuse you. And I want to get real serious when we talk about being a primary provider, because that'll be part of your vernacular, your jargon, wherever you go. We are primary providers. You know what that means basically and simply? One of the great things about a doctor of chiropractic, you don't have to have a patient that's referred to you from a medical doctor or from anyone. Patients can come to you directly. First contact. Now that gives a certain amount of responsibility to you as a primary contact provider. Suppose you was a cancer specialist, as an example. Maybe you're a tertiary provider as a cancer specialist. Maybe you specialize in some other systems of the body that you don't take patients primary contact. So I'm not saying that there's anything unique about us. We are just primary contact providers. Now that gives a responsibility of your training, your point of emphasis, what you're going to do here. You're going to learn how to be diagnosticians. Number one, capable of finding out the primary consideration that you are in this profession for. Does the patient that presents themselves to you, do they have a chiropractic lesion? Do they have a vertebral subluxation? That's your first responsibility. Is that patient suffering from a lesion that's within your area of expertise, within your specialized field? I want you to be careful with that, because you'll hear a lot about diagnosis here. You'll hear a lot about diagnosis on the national board. You'll hear a lot about diagnosis on the state board level, which you've all got to pass your test. Your responsibility as a primary provider is not a position to where you're screening patients who have diseases. Wouldn't it be a pitiful thing if you was a doctor of chiropractic and all you did all day long was take patients and figure out whether or not they needed to go to what branch of medicine? Do you think that's what it is right now? Wouldn't it be a pitiful thing that all you had to do is just relegate yourself down to cricks, backaches, and strains, a few little spinal distortions, a few little personal injury accident cases over here, and you spent all of your time in the laboratory, with your diagnostic procedures, determining whether or not these patients were suffering from medical conditions or medical diseases. If you examined 100 people, 30 or 40 years old, how many of them don't have anything wrong with it? I'm talking about sinus trouble, sinusitis. I'm talking about lymphogranuloma inguinale. They call that gonorrhea in a lot of places. After you've made all these diagnoses, how many people don't have any medical diseases? So let's get diagnosis in perspective. What's your first responsibility? The patient comes into you as a specialized field. A specialist is what you are. You are in a specialized field, and I'll clear it up for you in a minute. First responsibility. Does the patient have a chiropractic lesion, which we call a subluxation, that's correctable in your opinion? Does that patient that presented himself, can you manage the case? Can you effectively care for the case? Can you make the correct adjustment? Can you make the correct evaluation? Can you do the correct biomechanical procedures that you might have? Will it be effective for the patient? First consideration is the primary provider. Along with that first consideration, does the patient need referral? Does that patient need consultation with another health care provider? Big responsibility. Does that mean you start in a long, arduous procedures of a differential medical diagnosis? The answer to that one is real easy. No. You won't learn how to do a medical differential diagnosis here. You won't learn how to do a medical differential diagnosis in any chiropractic institution. I don't care what they say. None of them say it. You would not do a differential medical diagnosis to determine what the name of the disease, what the disease is, and what's causing it. You would, however, if the patient is suffering from a lesion that's within your area of expertise, The key to it is within your area of expertise, is what your reason for being, your raison d'etre of coming to Life College. You're going to find out intimately what your area of expertise is, how to perform the procedures in that area of expertise. Be experts, be eminently qualified in making all the legal determinations for the benefit of that patient within your area of expertise. That covers the chiropractic, analytical, and diagnostic procedures. Is that clear to you?